Good afternoon, and thank you for joining us. NADP is pleased to have Dr. Steve Keller, a longtime NADP member, volunteer, and NADP Gabriel Award winner as our webinar moderator. Dr. Keller, I have transferred control of the platform to our presenter, so let's begin.
Thank you. It's no secret that the experiences delivered by dental plans play a critical role in keeping members engaged, happy, and healthy. However, finding ways to improve the member experience while still meeting organizational goals can be a difficult balance to strike. We're fortunate to have Drew Corbett, an expert in member engagement, with us today. He will break down 4 strategies that can benefit both you and your membership. Drew will share expert insights on how to capture member communication preferences, incorporate a digital wallet option for ID cards, use explanation of benefits data to personalize the member journey, and effectively meet timely utilization management requirements at scale. By the end of this session, you'll walk away with actionable tactics your organization can implement to boost member engagement and achieve key plan perspectives. Drew Corbett is a healthcare industry veteran with over 18 years of experience in member engagement, product strategy, and organizational innovation. As VP of Engagement and Design at Clarity, Drew leads the creation of multi-channel program designs that drive member engagement and support unique plan goals. He works cross-functionally to guide campaigns from strategy and design through to implementation and insights. Drew, welcome, and let's begin.
Thank you very much, Steve. I appreciate it. And just going back to even the top line of why we're here today and what we're going to be covering, we talk about win-win strategies. And really the thing to keep in mind with that is we know that we're operating complex businesses, and part of what's needed to run those businesses are strategies that are easy to implement and easy to execute. Additionally, they have to be wins for your members so that those efforts are felt. And so when we talk about those win-wins, what we're hopefully giving to you today are things that you can fairly readily bring back to your organization and start to move in the direction of these things that, one, we know are approachable for you as an entity, but two, are going to have a yield when your members ultimately feel them, or when your prospective members hear about them when they're considering if yours is a plan that they might want to move towards. So what we're going to cover today, and Steve, you covered a little bit of this, but we want to set the scene for healthcare engagement trends. What are we seeing broadly in the industry? What do we need to be responsive to? And how are we really being asked to act much more as advocates for our members as consumers, rather than just as members of dental plan services? So we'll talk about those trends a little bit. And also where members are at in terms of their expectations, their wants, and their needs. The underscore here is that we know choice is a paradigm within membership attrition or membership acquisition. And the better that we can align to those expectations and wants and needs, the more likely we are to really fortify those membership numbers and grow them over time. We mentioned these 4 strategies, so we're going to spend time on each one of these individually, but managing and capturing communication preferences, leveraging new technologies that people are using in other consumer paradigms. Digital wallet is going to be one that we really move towards in the discussion today. The sort of unseen capability to utilize EOBs with those CDT codes to personalize experiences and add a tremendous volume of outreach that's really resonant to your members. And then we're going to talk a little bit on the regulatory environment and some of the things that you really need to be developing a skill set in order to stay relevant, stay kind of top of your game as it relates to effective and immediate correspondence with membership. So just generally, those are the few places we're going to go. And again, so as I mentioned, Clarity is an organization about 20 years old. We've exclusively served the healthcare industry, and we do so in the capacity of member correspondence entirely. So we work with over 100 different health plans, both on the medical, the dental, TPA, PBM side. And ultimately, this is a company that most Americans have probably experienced because we have printed, fulfilled, and distributed correspondence to all of your mailboxes or many of your mailboxes. But we do so just on behalf of those plans. So a big takeaway that I won't mention too many times through the presentation today, but certainly wanted to at the top here is all of the strategies that we talk about to drive member engagement, they're increasingly reliant and dependent on having a robust member correspondence platform in the underpinnings of what you do. So that is everything from the correspondence itself to the data management to bringing that engagement skill set closer to those assets. So you're really getting the absolute most out of the touch points that you have with your members throughout the year. All of the things that we'll talk about, Clarity's platform is well versed in. We're moving assertively to make sure that we can support the member engagement needs of dental plans. So whether or not you're working with us, I know many of you on the call are, or you're working with someone else, or you might not know who you're working with on a correspondence capacity. I would say bear in mind that if these feel like relevant strategies to implement, make sure you're really pressing on whomever you're working with on the correspondence platform to make sure that these capabilities are available. These really should become industry standard. And if they're not, of course, we're happy to talk with you. We'll share contact information at the end. But the importance of this platform is really becoming one that members are, unbeknownst to them, they're relying on the capabilities that you can get out of these things. So just wanted to share that. In terms of the core solutions that one that we offer, but two that a lot of these strategies are really deployed through today, member onboarding materials. So think literally those ID cards, those welcome letters, member guides, directories, etc. Also, post-claim payments, so EOBs, EOPs, and payments, the way that those are all managed, printed, fulfilled, distributed electronically, etc. Regulatory and compliance documents from 1095s to utilization management, we're actually going to talk about later in the presentation today. And then any other one-off correspondences like letters or invoices. So all of these, we've traditionally looked at them as kind of sunk cost correspondence. And increasingly, the value proposition is this can be hundreds of thousands, if not millions of additional touch points with your membership. To underutilize them from an engagement capacity is really a miss and is sort of leaving money on the table. So would encourage you to think about all of these from less of a cost structure standpoint and more of an engagement opportunity standpoint. We do have a state-of-the-art facility at Clarity that is wholly owned. So I think, again, this being a difference in a lot of the communication and fulfillment partners that are out there in the marketplace who might be contracting a lot of the actual fulfillment services out. We're vertically integrated from top to bottom. We entirely own our capacity. And why this is important, and we'll talk about this again within utilization management, is not only do you have a member engagement paradigm that relies on expediency, but in many cases, you also have a regulatory environment that insists on expediency and service level agreements that are being hit. Those are sort of the bread and butter of what Clarity does from a production standpoint, ensuring we understand the healthcare regulatory landscape and making sure that everything goes out. Again, you're seeing here with those hundreds of millions of packages a year, 99.9% of those being delivered earlier on time. So again, just kind of a housekeeping on this side of the industry that you want to make sure you're really buttoned up and tight, not only to meet the regulatory requirements, but also to meet the engagement opportunity.